Welcome back to Inspire Great Health, your local trusted healthcare podcast. Today I have a very special guest with us today. I have Landon Brown, who works at the CRMC Foundation, but he is also a representative, and we're going to be talking about healthcare legislation. So, Landon, welcome.
Thank you. Appreciate you guys having me.
Of course. I can't believe we've gone this far without having you on the podcast before.
Well, I guess that's lucky you guys.
No, I'm happy to have you. So Landon, go ahead and tell me a little bit about what you do for the foundation, but as well as some of your representative duties.
Certainly. So I think it's really important for people to recognize that the state of Wyoming still houses what we call a citizen legislature. And what that means is the people who are valuing our legislative process understood when we created the state, 135 years ago, that we don't want people who are professionals at creating laws and spending their entire days figuring out ways to create more laws and make life a little harder. So what we have right now is a group of 93 legislators across the state who have day-to-day jobs. And so that's me, and I work for the CRMC Foundation as the Director of Annual Giving and Grants. And in that role, it's my job to work with our community, do a lot of community development, and make sure that we're raising money to help support and inspire great health across our community. So both the positions work really well hand in hand with one another, work with a lot of the same people, and so it's pretty awesome to be able to be in a position where I can ask for money for the hospital, but I can also ensure that when we're talking legislature, people hear and see the things that we can carry across the board and make good laws.
Yeah, absolutely. So, Landon, you're going to have to level with me. I do not understand legislative speak at all. So I am at your mercy when we talk about this. So I'm going to ask you a couple of questions about a couple of House bills and Senate files, and you just explain to me in as layman's terms as much as layman's terms as you can, what these mean for patients.
Certainly.
Let's start with House Bill 4, which is birthing centers for Medicaid coverage. How does that affect patients?
Certainly. Very important bill in the state of Wyoming. One of the things that you have seen especially over the course of the past 4 to 6 years, is a very pro-life movement in the state of Wyoming. One of the things that we have started doing in the state of Wyoming is we've started seeing these birthing centers, and these birthing centers were not currently, or until this year, were not covered underneath Medicaid services. And so what does that mean? Basically, when you have a certain income threshold, you are covered by Medicaid as opposed to a private insurance company or anything like that. And Medicaid is actually a state insurance funding. And so what does that mean, and how does that ultimately relay down to the average person? Well, if you make underneath a certain threshold of income, you're covered by Medicaid services. And if you are going to have a baby and you choose to go to one of these birthing centers as opposed to a local hospital, which may be hundreds of miles away. We have a lot of locations across the state that have lost OBGYN services, but they have these birthing centers. And these, the biggest one that most people realize is the gap of coverage that we have between Evanston and Laramie now, where we do not have any OBGYN providers in hospitals, but we have some birthing centers. Well, now these birthing centers can actually claim Medicaid reimbursement to the state of Wyoming to help these patients who need these services to ensure that they have healthy babies when they are pregnant. And so we have now allowed that option to be one of the things that is covered by state Medicaid. Prior to this bill coming in this year, that was not covered. And I think it's really important to recognize we do not pay 100% of the services provided, but it is a fractional portion. It's usually about 65 to 67% of what those services cost. So there is still going to be a gap in services and what these services actually cost, but these birthing centers are a really important aspect to many of our outerlying communities.
So it's just a better way to open up options for mothers.
Absolutely. I think it's, again, when we have the OBGYN deserts that we have across the state, it's critically important that we have these options available for these providers, that you could have nurse practitioners, you could have just nurses in these locations that are going to do everything up and to the point of delivery. These are really, really critical pieces to these OBGYN deserts that we have created in this state. And having these services provided, at least some level of reimbursement from the state, is a step in the right direction. Is it going to solve it? Absolutely not, but it's a step in the right direction.
So next we're going to move into House Bill 122, which is the Wyoming Rural Healthcare Transformation Program. What does that do for Wyoming citizens?
Well, so that is we'll use big hand gestures. That is a very large bill.
Sure.
And that comes as a federal grant that came out of Washington, D.C. And so there's plenty of strings attached to it, and there is plenty of money to go around. For the state of Wyoming, it's going to equate long term to somewhere in the range of about $500 million. So $500 million to be basically injected into our health system across the state. To be honest with you, it's such a large bill and it covers so much and it's so expansive. I actually brought some notes to make sure that I can remember a lot of the things that it outlines.
Sure.
One of the biggest issues that it does address is our rural EMS issues. We have a lot of outerlying communities that do not have EMS services. So you think EMS, what is that? That's your ambulances, right? We actually have a lot of places. Pavilion is one of those places, Pavilion, Wyoming, up in Fremont County, that does not have an EMS provider. A couple of years ago, the state of Wyoming's legislature said, hey, what if we create districts that will allow people to tax themselves to assist with EMS services. So we did that, but nobody's willing to tax themselves.
Right.
Nobody wants to do this. They just want the government to provide. This is going to inject some money into that process to see what it takes to actually stand up an EMS service in some of these outerlying communities where people don't want to tax themselves and pay for the services that we provide. A couple of the other things that this does, we have critical access hospital money that's being injected into it, making sure that these critical access hospitals stay open 24/7 with an emergency room. There's some very clear delineation in Health and Human Services rules on what a critical access hospital can and cannot do and how long patients can and cannot stay there. We're not overriding that, but this is injecting some money into those critical access hospitals. So one of the big ones that we think about is over in Saratoga, for instance. Very, very rural area, and you have to drive all the way to Rawlins if you want an actual hospital. We're going to inject some money into those outerlying communities to make sure that those hospitals stay afloat. We have workforce education, which is a big one for all of the state of Wyoming. It's not just the rural parts, but one of the things that I think most people recognize is we're short on healthcare providers across the state, whether that's nurses, respiratory therapists, phlebotomists, you name it. So there is going to be a huge chunk of money, millions and millions of dollars going into the education of the workforce to make sure that we train those people and we have a workforce that is going to continue to see that pipeline as it comes in. So a lot of our community colleges are going to receive some benefits out of this, but it's also going to be the people that are applying for these jobs that are going to have that benefit. And then a couple of the other ones that we see here is OB care. We talked about that briefly. And then also our new technology. So we have tons and tons of technology that is out there. And one of the big ones that's really important that I think people recognize is electronic medical records, or EMR. And there's an opportunity out there for some of these smaller hospitals that have never had the opportunity to get EMRs and they're still working in paper forms. There's an opportunity for that new technology to be broadened from places like Cheyenne Regional Medical Center and Banner Capital up in central Wyoming to actually release and host EMR processes to some of these smaller outerlying communities. And there's going to be some money for these outerlying community hospitals, these critical access hospitals, to move into that EMR realm that were never available to do. So a lot of really exciting stuff.
Yes.
It's going to take 5 to 7 years for this to build up. Not to get dragged down into the menagerie of it, but there's a lot of really good stuff, and we have a lot of really good support from our federal delegation out in DC as well.
Well, it's exciting to see them reinvesting some money into healthcare in Wyoming.
Absolutely.
Now we're moving on to our Senate files. Senate File 4, Medicaid rate increases EMS services. Can you explain that to me as well?
Absolutely. So this kind of goes hand in hand with that EMS discussion that we just had a few seconds ago, where we actually have some EMS services in some of these outerlying communities, but they're operating in the red, right? And as a business, you can't do that. And a lot of these places are actually doing that as a community service provider. So they're actually a public entity that is losing money on this. Why are they losing money? Well, because Medicaid does not pay 100% of the services provided and the fees billed. they're operating in the red. So one of the things that the state of Wyoming saw as an opportunity to try to reduce that is to take the current reimbursement rate of 66% and up that to 100%. So now when you do have an EMS service provider in the community, they are going to be reimbursed at 100% of that rate as opposed to 66%. So every time that ambulance ran, for every dollar that they were spending in gasoline or dollar in wages to that EMT or to that paramedic, for every dollar that they were spending, they were only receiving 66 cents back on the dollar.
Oh my goodness.
Cheyenne Regional Medical Center, very, very cognizant of what that feels like. A lot of our community critical access hospitals are able to be reimbursed at a different rate when they have Medicaid services. And that's one of the things that we matched with this is that critical access hospital versus the Cheyenne Regional Medical Center. When we have a larger pool of money to pull from at a larger population base versus some of these rural communities, we need to make sure that those rural communities are reimbursed at 100% because they're not billing insurance agencies. A lot of these, we'll say ranchers, farmers, self-employed people, they just are not able to pay that. And so they're on these Medicaid services. The state of Wyoming is going to now fork out that additional 33 cents on the dollar to ensure that our EMS providers are fully funded.
Next, we're going to talk about Senate File 6, which is the eligibility for Medicaid criteria. How is that changing? Is it for the better or for the worse?
Yeah, so this was kind of one of those bills that was in response to, I think everybody saw it in the news.
Yes.
The Minnesota fraud and the concerns that everybody had about Medicaid fraud and what it was looking like up in some of these other communities and not necessarily in our state. And so, as we started talking about this bill, we're not really changing what we were already doing. The Medicaid reimbursement rate is, it's obscenely small in what we actually already see. I talked with the director of the Department of Health yesterday, as a matter of fact, and asked him, hey, what is our reimbursement rate, shortfall? And he says, well, last month we wrote a check for $140 that we overpaid on. When you consider the hundreds of millions of dollars that flows through our state in Medicaid reimbursement, we wrote a $140 check that we overestimated on. And it was not even we did this because somebody wasn't supposed to be covered. It was an over reimbursement. And so those types of things are what we were trying to control and make sure that our Department of Health has already run exceptionally well. What this means for that patient, what this means for the average Joe is that we're making sure that we're taking care of American citizens and we're taking care of Wyoming citizens that are eligible for Medicaid. There's nothing major, there's no criteria that is being shifted towards these people will not be covered now. We just outlined it in statute, which was originally and previously held in rule. We're not changing all that. Now it's just in statute to make sure that there is a criminal penalty if anybody starts advertising or promoting these people to be carried out and covered underneath Medicaid services that weren't supposed to be there. So it's a good bill. It basically, like I said, puts the practice that was already there into statute and prevents fraud from occurring at just that little bit of extra step level forward. It's nothing major. It's a scary bill when you talk about it, yes. But at the end of the day, it's just putting what we're already doing into statute.
And what is the difference between statute and rule?
So good question. What it boils down to in the legalese side of things, absolutely nothing. What it does mean is within rule, we provide at the legislative level, the executive branch has the opportunity to create rules. That's a lot more nimble and a lot more quick in a lot of cases. It takes a lot to get a piece of legislation through two bodies and signed by the governor. And so we typically give a little bit of authority to the Department of Health and any of these other state agencies to create rules. And that's where this was housed for the original time frame, is there was eligibility criteria that we said, you guys get a lot of stuff shifting here and there. Why don't you guys create that? Now we've said, you know what, we're going to create that. We're going to put it into statute. And if there's something that's critically changing, we'll take care of that. And that's more of a political statement than it is anything else that they're not doing a job. Like I said, the Department of Health has done a great job taking care of what they've done underneath rule. This was more of a political statement than it was the Department of Health not doing their job.
Now this one I do find interesting. It's Senate File 48, which is stem cell freedom. What does that mean?
This was a good little bill. long story short, to try to not break down a small podcast into over details that really
Sure.
don't matter, we have a couple of people within the state of Wyoming that have large sums of money that came into the state of Wyoming and said, hey, we'd like to have stem cells used to treat certain issues. I have a friend of mine that had a softball accident 10 years ago and lost nerve damage. And in the process of being able to do that, they said, you can do stem cell treatment, but you can only do it to this point because that's what the FDA clears. So he ended up having to fly all the way down to Mexico and have the stem cell treatment done in Mexico, where they can enrich your stem cells at a higher level than what the FDA clears. The Stem Cell Freedom Act basically said, we appreciate that, FDA, but the state of Wyoming is going to take it a step further, and we're going to allow the doctors within our borders to practice this same type of therapy. And we're going to allow them to do this without risk or concern about having the State Board of Medicine coming after their license or punitive damages for practicing outside of what we consider the scope of work. It also had some insurance topics in it, a little bit of information to say, hey, look, if you're going to bill insurance, you can't deny claims that would not normally be there. But this is really a good opportunity for the state of Wyoming to say, hey, look, if I'm going to have my own stem cells taken out, there's nothing that prohibits me from doing that except the federal government. And so we have basically said, federal government, we're going to take over this. This is a states' rights issue, and we're going to allow our doctors to practice this here in the state if they so choose. One of the things that's really important to make sure that people understand here is there's nothing requiring doctors to do this. There is still FDA regulations out there, and if a doctor here in Cheyenne says, hey, look, I don't feel comfortable doing that, and I don't want the FDA coming up and coming after me, they can still deny that treatment. But the doctors who say they do want to, and they're outside of their scope, so there's a clinic up in Gillette that is already doing this now. They have that authority. They can do that without risk of being caught in trouble with the Wyoming State Board of Medicine. So really a good bill, opens up a lot of opportunities for people here in the state of Wyoming to have their own stem cells treat medical conditions. The technology that we've had over the past 10 years is just phenomenal. And this allows the people in the state of Wyoming to continue to receive that care here in the state of Wyoming.
Oh, wow. Well, it's really good to hear that we're opening up those opportunities for people.
Absolutely.
All right, last one. We're moving on to Senate File 57, which is transparency in hospital pricing, which I think a lot of people will be interested to hear.
Yeah, so again, good little bill, and I think it's always important for people to recognize there is transparency in hospital pricing. This bill has a good catch title, and it made everybody feel warm and fuzzy inside. Mm-hmm. Really what we did, to be honest with you, Bridget, is we mirrored exact issues that are already being taken care of by federal law. Yeah. But what we did do is we added in the availability for the Department of Health to add punitive damages to hospitals in the state that are not currently doing what they should be doing. I think it's incredibly important to mention there's not a single hospital that was not up to date on this. By the time this bill was signed into law, every hospital was already providing these services, including Cheyenne Regional, including Platte Valley. All these different community hospitals already have this. It's already federal law, and it was already required. The problem is, and I think a lot of people recognize this, we don't like the federal government encroaching in on states' issues.
Sure.
That's where this bill came in, is we said, hey, federal government, if there's somebody not doing their job, we'll take care of the punitive damages. Yeah. You guys don't need to worry about it. So that's really what this bill did. There's some very finite details in it on what's required, but it mirrors the legislation that was already passed at the federal level. And I appreciate Senator Brennan bringing it forward, because it does allow us to make sure that we retain the availability of taking care of those punitive damages at a much less severe level than what the federal government would have done.
Okay, so good to hear. Good to hear that we were already doing that, and this is just kind of solidifying it for our state.
Yeah, absolutely. Yep, we had a lot of good healthcare bills that ran through this year. These were just a few of the topics of discussion across the board, but I think it's incredibly important to remember you've got a citizen legislature, so you've got 93 different walks of life that are all coming at all of these different bills from a different point of view. Sure. And to get these particular bills signed into law is really important, and really it encapsulates this idea that everybody is being represented by their communities, and we heard from 93 different communities, 93 different points of view, and we have really good policy that went into law.
Yeah, well, very good. Good to hear that all these people are coming together to really improve Wyoming and make Wyoming just more healthcare friendly and reinvest into our citizens.
Absolutely. Thanks, Bridget.
Of course, thank you. Is there anything else you'd like to add?
No, I appreciate the time and I appreciate the willingness to have a lawmaker on your podcast. It's probably a first, and you'd probably be the last.
It is the first. I hope it's not the last. But I thank you for your time. Thank you for joining me. I know you're a very busy man. You're a business owner, you're a representative, and you work for the hospital. So I really appreciate your time.
Not a problem at all. Thank you so much.
Thank you. And thank you for tuning in. Be sure to tune in next time. We're going to be talking about the Spring into Brain Health Symposium.